I would like to talk to you about your role in continuous process improvement.
Is this about how we are going to become lean like Toyota and Virginia Mason, and tell everyone where to put their stapler?
No one is going to tell you where to put your stapler. CPI is about reducing waste and unnecessary variation. It improves patient outcomes and increases efficiency.
I like my stapler where it is.
No one is going to tell you where to put your stapler. But if we can standardize our processes and get to the best process, we can save money and give better care.
You want everyone to do things the same.
Not always. But unless there is a reason to do it differently, then, yes.
Everyone can do it the same, as long as they do it my way.
That seems to be the prevailing opinion.
That everyone should do things my way?
Let's talk for a minute about forms. Forms are a simple thing to standardize. We spend a lot of money printing them. The staff spend a lot of time figuring out which ones to use for which doctor. Patients don't like filling them out because they are repetitive. It's not efficient.
But I like my forms.
In your section we have 20 doctors, and 24 different patient intake forms.
Oh.
4 of them are yours.
I like my forms.
Do you have to have 4 different forms that are different from anyone else's?
My patients are different.
Are they?
My patients are sicker.
Really?
My patients are more needy.
Really?
My patients are more non-compliant.
Really?
My patients ask more questions.
Really?
My patients look more things up on the internet.
Really?
My patients need the special forms because they are special.
And nobody else's patients are special?
Not as special as mine.
And this specialness manifests itself in a need for special forms?
Yes.
Why?
If all the questions I might need to know are on the form, then it is more efficient.
More efficient for whom?
More efficient for finding out information.
Your staff spends 5 minutes figuring out the right form, and your patient spends 15 minutes filling it out. How is that efficient?
It's efficient for me.
But is it efficient overall?
If it's more efficient for me, then it's more efficient for everybody.
Is it possible that that's not true?
What?
Maybe a little less efficient for you can be more efficient overall.
That's preposterous.
If your staff didn't spend 5 minutes finding the form, and the patient didn't spend 15 minutes filling it out, you could see them 20 minutes earlier.
But the questions wouldn't be answered.
Maybe you could ask the questions yourself?
What?
Just ask the relevant questions yourself instead of having them all be on the form?
That wouldn't be efficient at all.
Your patient surveys say you never look at the form anyway.
Sometimes I do. Just in case, it's very important that it be the right one.
So you don't think you can standardize the form, or maybe even get rid of it?
No.
But we are trying to be more patient-centered.
Of course I am patient-centered.
What does it mean to you to be patient-centered?
Patient-centered means doing what's best for me, so I can take care of the patient.
Perhaps we should explore that definition a little more.
I don't know about all these new lean ideas. Why don't we just go back to the old way?
The old way wasn't working.
It was working for me.
The patients weren't getting good care, and the costs were increasing out of control.
Well, yes, I suppose there is all that. Maybe it wasn't working so well after all. You really think that changing the forms is going to help?
I think it is a beginning.
Well, okay then. I will try.
You will?
Yes, I will.
Thank you.
But, one more thing.
Yes?
I think you ought to move your stapler.